Roughly 2 million people have been vaccinated so far. David?
Carter, thank you. We are joined now by Dr. Ashish Jha. He is the Dean of Brown University School of Public Health. Dr. Jha, good morning. Let's start with what Carter just said. Only 2 million vaccinations so far. They were hoping for 20 million. We've heard experts say if enough Americans are vaccinated, we could return to normal by the summer. Does this now throw off that timeline?
Good morning. Thanks for having me on. I'm still hopeful about that timeline, but there's no doubt about it that things are going a little bit more slowly than we want. I think we need to really ramp up the vaccination, get the vaccines out to states, but then also get the vaccines from the states into people's arms. It's going more slowly than I think any of us would like.
Let's talk about the Oxford University AstraZeneca vaccine. UK media is reporting it could be approved by this week. What do you know about the data regarding that vaccine?
Yeah, the data that's been released so far suggests that it's not quite as good as the Moderna and Pfizer vaccines. Over the weekend, the CEO of AstraZeneca came out and said, we have found a magic formula, and now we figured out how to make it as good. And my critique is, well, that's great. Love that. We want more vaccines. Can you show us the data, please? And we don't know what the new data is that he's promising. I'm hoping we'll see it this week.
When you say not as good, what do you mean?
Well, it's just not quite as effective. It seems pretty safe, but it does not appear to be as effective as the Moderna and Pfizer vaccines. Those are both 95%. The data from AstraZeneca Oxford suggests it's more like 70%.
Let's talk about the new mutated COVID strain, right? So it's been found in the UK, France, Spain, even Canada. Do you think it's here in the U.S. already? And are the current vaccines effective against that strain?
Yeah, two great questions, David. I do think it's probably here. We don't know. We're not monitoring for it in the way that the UK and other countries are. So first thing we have to do is start really looking to see if that variant is here. My hope is that the vaccines that we have right now probably are going to end up being effective. We have no reason to think they're not, but we obviously should verify that and test that out.
When it comes to receiving the vaccines, we know that it will reduce the symptoms, right? I had a doctor in California say once he received it, I'm not going to die from it anymore, right? I'm not worried about that. But will it reduce the possible transmission of it once you have the vaccine?
Yeah, that's absolutely critical question. My best guess is it will. Most of the data so far suggests it probably will, but the data is pretty light on this. And again, we're learning so much about these vaccines. I expect in the next few weeks we'll know more, but my expectation is that they will reduce transmission. Probably not 100%, but they should lower it substantially.
Dr. Jha, what happens to the global rollout once AstraZeneca's vaccine is approved? Will it be more widely available in countries like India and other parts of Asia?
Yeah, so AstraZeneca, the reason I've been paying really close attention to AstraZeneca is that's the one that the world is sort of making the bet on. India has made hundreds of millions of doses of this vaccine. If the UK approves it this week, I expect India to approve it. I expect other countries to approve it. And then I do expect a global vaccination campaign really getting going, probably based on this vaccine. One of the reasons